Welcome to our comprehensive guide on brain aneurysms. Today we'll explore the different types of brain aneurysms, delve into their causes, and discuss the symptoms that should never be ignored. We'll also take you through the diagnosis process and discuss the treatment options available. My goal today is to equip you with the knowledge you need to understand brain aneurysms and advocate for your health or the health of your loved ones. Let's start by understanding the different types of brain aneurysms. The most common type is the saccular aneurysm, often called a berry aneurysm because it resembles a small, round berry protruding from a blood vessel wall. Next, we have fusiform aneurysms, which appear as a bulging or widening along the entire circumference of a blood vessel. Lastly, there's the dissecting aneurysm, involving a tear in the inner lining of the artery wall, potentially causing a dangerous separation. Now, let's shift our focus to what causes these aneurysms to develop. Genetics can play a significant role, particularly if you have a family history of aneurysms or connective tissue disorders. High blood pressure and smoking are major risk factors as they damage blood vessels and elevate blood pressure. Other factors include atherosclerosis, head trauma, infections, and stimulant abuse. This brings us to a crucial aspect of brain aneurysms, recognizing the symptoms. Unruptured aneurysms often don't cause noticeable symptoms unless they are large. Large aneurysms can press on surrounding nerves or brain tissue, leading to persistent headaches, changes in vision, or weakness on one side of the face. Ruptured aneurysms are medical emergencies requiring immediate attention. The hallmark symptom is a sudden, excruciating headache, often described as the worst headache of someone's life. This may be accompanied by nausea, vomiting, a stiff neck, sensitivity to light, loss of consciousness, or seizures. If a brain aneurysm is suspected, diagnostic tests will be performed. Imaging techniques are essential for visualizing the aneurysm and determining its size, shape, and location. Commonly used imaging tests include CT scans and CT angiograms, which provide detailed images of blood vessels. An MRI may be used to create highly detailed images of the brain and blood vessels without using radiation. For a comprehensive assessment, a cerebral angiogram may be performed, involving a thin catheter and contrast dye to visualize the blood vessels. The treatment for a brain aneurysm depends on several factors, including the size and location of the aneurysm and whether it has ruptured. For unruptured aneurysms, a watch-and-wait approach may be recommended if the aneurysm is small and not causing symptoms. Minimally invasive options like endovascular coiling or surgical clipping may be necessary for larger or symptomatic aneurysms. For ruptured aneurysms, emergency treatment is crucial to control bleeding and stabilize the patient. Thank you for joining us in this detailed overview of brain aneurysms. Early diagnosis and management are key to better outcomes. We've covered the types, causes, warning signs, diagnosis, and treatment options. Use this information to advocate for your health or the health of your loved ones. Remember, with the right information and timely intervention, there is hope for a positive outcome.